Welcome to Brain Wellness, the podcast. I'm your host, Mandy NP. What started as all things related to brain health and wellness has morphed into largely brain injury health and wellness, with occasional other neurological topics. My mission remains the same, to help you on the path to a healthier brain. So, without further ado, let's get into the show. Hello, everyone, and welcome back to another episode of Brain Wellness, the podcast. My guest today is Dr. Carmen Frede. Carmen is a brain injury expert, author, advocate, and a board-certified nurse practitioner dedicated to redefining traumatic brain injury recovery, specializing in the critical transition from acute emergency care to long-term neuro-rehabilitation. She is a recognized leader in evidence-based concussion management and patient education. A University of Kentucky graduate, her doctoral research established new standards for discharge education and patient outcomes. Recipient of the Sigma Theta Tau Leadership Award and a longtime leader with the Brain Injury Alliance of Kentucky and Indiana. In her book, Wired Differently, she translates complex neurology into a compassionate, actionable guide for survivors and families. An avid mountain biker, Dr. Frede draws parallels between the resilience of trail riding and cognitive recovery, nature and movement as vital to neurological health. Her mission is simple, ensuring no survivor navigates the path to recovery alone. Thank you so much for being here today, Carmen.
Thank you.
Of course. So, new to my show, I don't know if you've listened to any of the episodes yet, or you will be soon, because we're going to be tag teaming here soon, and we'll talk about that probably a little bit later as well. But my first question to the guests is always, tell me a little bit about your story. We got a little bit in there, but what brought you to doing what you're doing now? And share it as much or as little as you want with that.
So mine was, I was a nurse, working normal shifts, and decided to take a trip to the mall one day when I had this leisure day off and had a car accident. And that kind of just changed my life in a way where I don't even know how I came about getting here today, other than I had a lot of resilience. But yeah, it was a path that I had to navigate, not only as a nurse myself, but also realizing how are individuals supposed to navigate this without any healthcare background. And it really resonated with me that there needs to be somebody to fix the system. And of course, that was one of my biggest motivators was, don't tell me I can't do something. I think out of every single provider I saw was like, well, you should look at doing something else. And I'm like, well, I'm sorry, screw you. I'm gonna keep going. And I did actually come across one doctor. He was a physical medicine and rehab doctor, which unfortunately he was an Ohio State alumni, so we won't get into that. I'm a Michigan alumni. We are destined to hate each other.
The Ohio State, yes.
Yes, yeah, right. We're going to keep the B out of there. But anyways, he did push me new boundaries, figuring out that redefining my limits. And I love that because I was like, okay, this is a new me. And I harnessed that strength and was like, you know what? I'm going to go get my doctorate. So literally, instead of going back to the bedside full time, I decided, all right, I'm going to go part time and apply for graduate school, and got into the University of Kentucky. From there, I was destined to set out to change the protocols on discharge management. And I started with education in the ER, and it actually proved to be statistically significant, which was really good. And I, I graduated and kept that mission, realized that there's a lot of broken systems. So I think I was a little bit naive to think that one protocol change would change the world. So that actually resonated with me on, I'm going to write a book because I'm tired of telling everybody, looking for all these resources. And I had started a journaling system when I was going through my recovery anyway. So I was like, well, there's probably something else out there. I couldn't find it. Maybe I just didn't look hard enough. And I was like, well, I'll just publish my book. If it helps somebody, great. People can just throw it in the trash. They would. It's one of those where I really felt that it's something to help navigate. A lot of it is just exposing vulnerabilities, because being a nurse, it's like, well, we see everybody naked. So here you go. This is my book. This is me. But it's really the tools that are in the worksheets that are in the back that I really wanted individuals to take and help them navigate their provider visits, because that's something that I wish, people had more resources for, because you get into a doctor's visit and you get like 30 minutes with this person, and half the time they're running behind, and it's just like, well, I'm here to talk about one symptom apparently.
Mhm.
And that's not right. So that's kind of where I left off with my book, just navigating through.
That's a great way to look at it. What were some of the struggles you faced early on?
Mine was a lot of memory. I could not remember things. I actually didn't even remember the car accident. I was fighting with a police officer, apparently. So my husband showed up. Thank goodness, because it sounded like I probably would have been arrested. I don't know. But repeating myself, having some irritability and headaches. Oh my gosh.
Mhm.
I think I lived in the bathroom. The toilet was like my best friend. I was like, if I could just get a refrigerator in here, I think I'd be good. But yeah,
Gosh.
that was my hardest. That was really hard, the first beginning
Mhm.
stages.
Mhm.
But picking myself up afterwards, like saying, I remember this migraine that I was navigating to get my abortive medicine to get rid of it. And it was in the kitchen, and I was in the bedroom, and I'm like, I have to crawl on the floor to get to the kitchen. And I just remember telling myself, nobody's here. No one's going to do this for you. You're going to have to
Mm.
get up and get that medicine. And I did. I got right up. I maybe stumbled around the walls a little bit, but I did get there. And I was like, if I can tell my mind to do this, I want to see what else I can tell my mind to do. So, and that's basically telling myself, coaching myself, all right, this is what I want to do. And that indirectly just kind of moved my body to get to where I needed it to go. So
Yeah.
that was the first couple of months.
Okay. Okay. How long did it take to get through those headaches? Do you still have them, or is that a thing of the past now for you?
So headaches, they're much more controlled. They're intermittently, I call them my flares. Being a mountain biker, I've learned that you also have other symptoms when you're exerting yourself on the bike. So I get headaches if I don't wear my glasses, because there's this visual sensory overload while you're multitasking. So it's almost like you're stuck in a graviton, which I'm like, oh gosh, I remember that was the worst carnival ride ever. But when you're on a mountain bike, you're like, okay, I can't be on a graviton or I'm going to fall off this bike. And who knows, go down a terrain somewhere and off a cliff or hit a tree, and then I'll be back with another concussion. But it did open up of, okay, I have to really focus and do some work, like worksheets for my brain
Mhm.
on the vision, which that was going back, remembering those vision exercises. But a lot of that also, I think, is age related too, as we start to evolve. And I hate the word aging. I'm going to use the word evolving.
I like that.
Yeah, I didn't adapt the way I should. So apparently my eyes are like the 80-year-old. I mean, everything else is like 80 years old, but I'm not even 40 yet. And I gotta keep doing the vision therapy because now I'm in bifocals. So, but it is a component. You do feel like you do go backwards at times, but it is part of the whole adaptation process.
Yeah, the recovery is not linear. At one point when I was going through and writing my book and writing down my stories from that too, I kind of came up with the idea of a shoots and ladders game. So you're a little bit
Oh,
younger
yeah.
than me, but you probably still played that game, and it's totally the ups and downs of the nature of recovery too. So sometimes it is a little bit more backwards than it is forward, and you feel older than your age many times.
Oh, yeah.
Yeah.
My poor husband, he's like, you already said that. You repeat yourself. I'm like, yep,
Mhm.
sorry, honey.
Yeah.
80 years old again.
Yeah. Oh gosh, there were times that I would repeat myself to my kids, and I have teenagers in the house still, and they would just look at me funny, and I'd ask them, I've already said this, haven't I? Yeah, you have, Mom. I'm like, all right, well, prepare to hear it again because I'm sure I'll say it again.
It's very important information. That's why
It
we
is.
repeat it.
It is. It is. What tools other than that kind of inner coach that you had? What other tools were really good for you as you were healing?
So humor was one that came later.
Mm.
Um, that one, I have this great example is first time after my injury, there was unfortunate celebration of life event, seeing my husband's extended family, and there was family members that I never met. So I was like, well, let's just do it. Let's just, throw myself into this shitstorm and see how I navigate through socialization. And the ironic part is I try to engage in a conversation on hunting, which I do not do. Instead of using the words peasants or pheasants, I use peasants. Yeah, I did it again. I was like, and everyone started laughing, and I'm just like, what did I say? I'm talking about the bird here. Why is that funny? Well, I didn't realize that they were like, yeah, the ultimate game. You're going to start going after people. And I'm like, that's not what I meant. But instead of laughing at it, I literally started crying. Like, I was like, I just ran away from the situation. My poor husband was just like, it's okay. This was actually really funny. So then I just was like, if I'm going to have these moments, I'm going to name them, call them word farts, because they just come out and I don't know when they're going to happen. Try to have some control when they're going to happen. But I figured, you know what? This is my confidence. I'm just going to throw it out there. We'll figure it out. I've gotten through my recovery a lot faster with the humor. So I tell a lot of my patients, I'm like, you have to have humor. I know it sucks to hear that because you're like, how is this funny? But you got to be able to laugh at yourself. You're going to make mistakes. And that's part of this. That's part of the recovery.
Yeah. Yeah. We turned it into a joke also when I would say the wrong things, and we would just say words are hard, brain is dumb. And people would look at me funny when I'd say that. I'm like, no, it's funny. Like, seriously, it's funny. It's okay. Like, words are hard. There are times when words do not want to come out of my mouth appropriately. And it's okay. It's when I first came back to my podcast, I tried cutting that out, and I would like minimize my word issues. And finally I got to the point where I'm like, you know what? I don't care. We're just going to leave that in there, and people can see that, yeah, I still struggle with words every once in a while because I'm human.
Yeah, I struggle with emails or messages. That's like, I think my biggest residual is I write, well, my husband calls them girlfriends. They're girlfriend emails. And I'm like, what is that? I'm just like writing my point across. He's like, no one's going to read that. He's like, you can bullet point it. And I'm sitting here like, oh my gosh, nobody's ever told me that I write all these long messages. And I'm like, well, that makes sense. Now I'm apologizing to people. And then I'm like, you know what? This is me. I'm just going to embrace the girlfriend messages. And ironically, I found some other individuals, guys in my pod that write girlfriend messages. So I'm like, you know what? We're going to get along just great. Yeah. We are very detailed oriented. We're going to be, I'm like, if no one wants to, people can skim my message now, or now there's like this AI tool to summarize it for you. I'm like, you know what? I'm not going to change myself for these people.
Yeah. No, it's all good.
So there's this running joke now of Carmen's going to send an email. Oh boy. I have gotten better though.
Good. Yay. Baby steps, right? Got to take the celebrations where you can. Yeah. Are there, and I'm going to assume I already know this question, but are there things you wish you would have known about concussion recovery before you had your own?
That you should not go back to work the day after your concussion. When the doctor says, yeah, you're fine, everything's fine. Yeah, no, I went back to work and I could not remember the floor that I worked at. And I had been there like many years and was like, wait a minute, what am I doing here? Where's the bathroom? I seriously was like, something's wrong with my brain. But luckily I've recognized that. That's what I call the safety zone of you can recognize your limits. If I didn't have that, I don't even want to think about what would have happened. But it's like I recognized those safety zones and I was like, I knew I need to ask for help. I need to get out of this danger zone. So that's another thing that I wish that I knew. And that's one thing I start conversations with my patients of, what's your safety zones? Do you have one? If you don't, you're not going back to work. Because I don't want to put you in a situation where you don't have that cue to not do something unsafe.
Yeah. Because there are a lot of times patients are not aware of the problems that they have. I was one of them. I had no idea that I wasn't remembering things right away. And I would tell people, yeah, I'll call you back, and never call them back, or almost screwed up the finances in my household because I forgot about a few things with our finances, and it was dangerous, and I had no idea. And I see that in my patients time and time again, that they don't realize all the things that they have going on.
Yeah. I was fortunate that we recognized it early. But yeah, there was things where I would like double purchase, maybe triple purchase things. Luckily, they were returnable.
Yeah.
But I'm just sitting here like, there should be a safety net on like spending costs for somebody that forgets or like alerts, which I found out there was. But then my poor husband was like, I feel like you're like child-proofing everything. And I'm like, well, in a way, I kind of need to because I don't know what I can do at this point. I don't want to do something where it is detrimental. So that was the one thing that I had to kind of like give up on myself a little bit is relying on other people, which I'm horrible at because I'm always the one to like, I have a plan, I have survival instincts, and not having those and relying on other people was like, I don't know if I can do this. This is going to be different.
Yeah. 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 I think I've found that a lot of people that have brain injuries are very independent individuals who don't like to rely on others for help. And I don't know if that's part of why people kind of downplay symptoms a little bit is because they don't want to admit that they have issues or they don't want to admit that they need help. Or if it is more like what I experienced, I had both. So I didn't want to admit that I needed help and I didn't know I had symptoms. So I wonder if there's a little bit of both of those things going on.
Yeah, I definitely think the both. Because I did recall not wanting things in my chart so I wouldn't report because I was already like, they're going to start judging me. It's going to follow me. And anxiety was like the one thing that everybody seemed to focus on with me. And I'm like, I grew up with a very dysfunctional household, mental illness in my family. And I'm sitting here like, that would make more sense to me if, that was going on with me. But just nothing that my providers were focusing on seemed correct. I was like, no, it's
Yeah.
not that. Definitely not that. But I mean, I could have all of that given what the situation I'm going through. But I would say that's not a primary diagnosis. But to lose trust in your healthcare system or healthcare providers when you're very vulnerable and trying to navigate, that was the biggest hurdle that I had to kind of get over. I was kind of like, this is something that maybe nobody really understands. And I was just fortunate that I got to somebody that did. But that just made me more aware that there's all these gaps and a lot of people walking around concussed without any help.
Yeah. Yeah.
Which is, yes.
So is that kind of what pushed you into doing what you're doing now?
Yes. Because I honestly, I see a lot of individuals, especially mountain biking. I always hear the word can't. It's like, why would you use that word? That word should not be in your vocabulary. It should be a can't now, but can do later. And I got deer in headlights when I started saying that. And they're like, are you like, what is wrong with you? And I'm just like, no, because you don't even know what you can do. Have you been on a bike? Have you tried something? Have you even, visualized yourself on a bike? That is a thing.
Yeah.
And it started to get into, well, they just gave it up. And I'm like, well, that's sad. Don't give something up that you enjoyed. Test it out. Go, there's pads, go put on the Michelin Man gear. I mean, that's what I do. And that way, if you tumble down the mountain, you're covered in gear. You're not going to injure yourself. But a lot of them they just gave up. And as soon as I started questioning that, they were like, I'm going to bring it up to my provider. And I'm like, ask to do some therapy, see where your new baseline is. And a lot of them are like, my performance is better since I got checked out. I'm like, see, you're back on a bike. Look at you. So that's kind of where I hated to see people self-limiting themselves. It's like, why would you define yourself by the injury? The injury should empower you because in a way it's going to make you smarter because now you're having to learn as an adult. So
Sure.
that's really hard.
Gosh, yeah. Yeah, it is. I was going to touch on one of the points you made about how not talking about what you can't do now. It seems like an eons ago that I was a Beachbody coach. And have you ever heard of Tony Horton, the guy that does the P90X?
Yes.
So one of his like taglines when I first did P90X with him, he was always like, I don't want to hear anybody say I can't. It's I presently struggle with.
I do. I praise.
Yeah. Yeah. So it's not I can't. Can't is a 4-letter word at that point. It's like I presently struggle with. But it doesn't mean you have to constantly struggle with it. So you can get better. You can improve. You can find safer way to do things. So yeah. I'm curious, when did you get into mountain biking? Was that before or after your injury?
So that was actually after. I know. I was a road biker. Then I didn't like cars because they were coming too
Yeah.
close. And it was actually kind of, I like to leisure gravel bike. So I did like a hybrid mountain bike, but then I got bored with gravel. And my husband was like, well, let's just go to this trail. And then at first I like jumped off the bike and was like, no, I'm going to hit a tree. I'm going to get another concussion. But then I started thinking about it. And I'm like, was that fear talking or was that me actually saying I just couldn't do it or my brain wasn't ready for this? And then I realized it was fear. So then as soon as I recognized the fear, I was like, okay, I am not one to let fear define me. I'm going to figure this out. So then I challenged myself. I watched him do one of the hardest mountain biking races. It's up in Marquette. It's called the Marjorie Jessic.
Okay.
And then apparently my, self decided, oh, hey, I'm going to do it too. So yeah, we're going to probably laugh about that all the way through, but I'm determined to finish this thing. But it was one of those, I saw all these people starting off with fear doing this race. And I'm like, this should be fun. You're actually testing your limits. Like I had to be pushed to test my limits, like forced into the corner to figure out this is your volunteering to test your limits, which is even more interesting because I don't know if you're crazy or if you're actually really, glutton for punishment here. But at the same point, I was like, the neuroplasticity is almost, I don't know, it's, I don't want to say addicting. That's the wrong thing. It's just more of like, you can do things that you never thought you could do. And that's what I like about it. Now, I did learn that I am not allowed to be glued to my bike with cleats because I fell and broke both arms 6 weeks apart. We won't talk about that.
That's crazy.
Yeah, there's no fun story. It was in the parking lot for one. The other one was on the sidewalk. Just like, I didn't even hit a tree. We didn't even make it to the trail.
Oh, man.
I know, because everyone's like looking at me. They're like, oh, you did this mountain biking? I mean, yeah.
You got a cool
No,
story to
not
tell,
really.
right? I mean, you were on the mountain bike. So
I was there. Technically, yeah. Mountain biking story. Just, we didn't really leave the parking lot one day. And then the other day, yeah, I don't know. Gravity sucks.
It does. It does. I kind of find it funny that you started mountain biking afterwards because I did also. I was a road biker and my husband used to mountain bike all the time before we even met. So he used to do this all the time. And it was 2 years before I got back on my bike because my balance was not quite right. And we started on the roads and I was doing just fine. And he's like, you know what, let's just try like a little green course and you'll be just fine. And we'll just try it and see if you even like it. And I tried it and I went around and I was super cautious the first time around this little teeny green course. The second time around, I thought, you know what, I'm going to test it a little bit. I still wasn't going fast by any means, but I went around this corner and I'm like, you know what, I'm not going to walk around it. I'm just going to try to glide around it. No, my front tire got stuck and I went over the handlebars and tore my rotator cuff. Didn't realize that I tore it because I had dented my helmet a little bit. So I did give myself a little concussion again. I was more worried about that part than I was about the shoulder, but it did not stop me. We still went for multiple rides after that. It just hurt. And then it kept getting worse because I kept using it. But I'm like, you know what? No, I'm not going to. And even when I ended up having surgery, I'm still like, no, I'm still going to get on that bike as soon as they tell me I can because I bought a brand new bike and I'm going to use the dang thing. So yeah, it is funny how you'll test your limits a little bit more. And I've never been that person that's like, oh yeah, I'll just do it. I don't care. But I am now.
Yeah, I used to be that person, just more of the skydiving, paragliding. Yeah, I've no roller coasters for me. But on a moving obstacle, yeah, I could do that. I'm like, all right.
Oh,
but yeah,
gosh.
so possibly future Marjorie partner,
Maybe. We'll
mountain
see.
biker.
Yeah, what's my
Yeah.
shoulder?
We're gliding for punishment. It's mostly walking or hiking a bike anyway.
Sweet, I can do that. That I can do. Here we go.
Yeah.
We should.
It's only 50 miles.
We should totally do that. Gosh. All right. So we were going to call this episode The Unfiltered, and we were going to be mouthy, and we haven't done it yet. So should we take the filter off and talk a little bit more real?
Not done the mouthy?
We have not, and I don't
Man.
know how that's happened.
Yeah. Wow. I must put on my provider pants and just forgot.
I know. You got the big girl words coming out instead of the other ones. So I guess we'll talk a little bit more professionally still. How do you utilize your experience when you're working with your patients? Do you share stories with them or do you keep some of those details to yourself?
So I kind of keep them at first to myself. Of course, right now we're on this media kick where let's just share every story. And I'm like, great, this is awesome. Luckily, a lot of my patients are not on social media. So I'm like, okay, they haven't seen it. But at the same point, it's like I gauge it because some people, like for me, it's like I didn't want it to turn into my provider telling me about their recovery. I wanted to feel like I was listened to.
Mhm.
But when I hear the words, you don't get it, I've been dismissed, nobody gets it, then I'm like,
Mhm.
okay, I'm going to be
Mhm.
real. I've been there. I've been on that shit side. I'm not picking up your shit stick, but we're going to, get some tools to walk it through and I'll just carry the torch down the dark tunnel so you can carry it. You can
Mhm.
see where you're going. But every patient's different. I treat
Mhm.
everybody different because
Mhm.
no one concussion is the same, which is funny. A lot of people think all the symptoms and treatment plans the same. I'm like, man, I wish it was that easy.
Yeah. Yeah. Oh, gosh, it would be super easy. I think about my life before brain injury, and I was a stroke provider. So there's a strict way that you go about treating stroke patients. And you have to do X, Y, and Z, and you follow the protocol, and that's what you do. That is so not the case for brain injury.
No.
I heard somebody, I think it was last year at the National Brain Injury Conference, they said once you've seen one concussion, you've seen one concussion.
Yep.
And yep, yeah, there are similarities, but there's a lot of differences. So treating them all the same is not even an option.
Yeah. I'm finding the visual spatial thing is very commonly missed,
Mhm.
especially on moving objects.
Yeah.
So, like mountain biking. Nobody tested me on a mountain bike before they cleared me. Go further. You can ride a
Right.
bike. Yeah, on a stationary, put me on a trail and trees and stumps. Like I'm doing all sorts of things, balancing, multitasking, trying to make sure that I don't hit the tree.
And you've
Plus,
got
I'm
the
probably
landscape
listening to
moving around
music.
you. Yeah.
But yeah, nobody tests that. And there's jet skiers. People get
Mm.
concussions off jet skis and they're wondering why there's not able to walk afterwards or balance. I'm like, well, yeah, because they're most of the water and you never put them on a jet ski for their
Mhm.
recovery. That'd be really cool rehab, though.
It would.
I would volunteer. But yeah, every concussion's different. Every injury is different.
Yeah. Yeah. Have you done any talks sharing what you've learned with other providers?
But that is a new part for me because in the beginning, when I was going back to work, I got the whole kind of like almost stigma or over micromanaging or
Mm.
feeling like I couldn't do something. So I was like, I didn't want that in my current job. But then I'm like, I did get my doctorate. That should be enough. But I mean, I started to. I shared mostly with a neurosurgeon because ironically, we share a passion for brain injury. This is the weirdest thing. He's also an Ohio State alumni. I'm like, man, where's all the Michigan? I apparently am on a same wavelength with Ohio State,
There you go.
and that's questioning, is this the right wavelength? Yeah, so I shared about my recovery, and it was mainly to help his patients because
Mm.
he was like, I don't know what to do. This isn't my realm. And I'm like, well, you need to send him here. And he's like, and I will be honest, this is the first neurosurgeon that I've ever really met. Now I've met a few more, but that experience, I was like, okay, you're like the best neurosurgeon because you
Mm.
actually care
Mhm.
about their recovery after their injury, even if you didn't even operate on them. I'm like,
Yeah.
that's pretty cool.
Yeah. Yeah, that's unusual. When I was working in the hospital, we'd get consulted on neurosurgery patients all the time because they'd have a head bleed, and we were getting consulted in neurology because they still had symptoms. And well, why do they still have symptoms? Like, well, because they had a concussion. Like, if you hit your head hard enough to cause a bleed, there's also a concussion. So we probably need to manage that part as well. And most of the neurosurgeons at that point didn't really address that. Yeah, there were some, but most of them didn't address it. They're like, well, they just said they had a bleed. Well, no, it's not that easy. It is literally not that simple.
Yeah, I would say, and I don't know if it's just my environment that I'm in because we're very research
Mm.
oriented, but there is a lot of communication. and a lot of questioning and team players. And I'm like,
Mhm.
this is great. This is
Mhm.
awesome. But I'm like, I don't think I got that when I was in school where
Mhm.
I was at, and I was in a different state. And I'm like, I wish every hospital had
Yeah.
this sort of communication,
Yeah.
which I know that that's not the case.
Yeah. Yeah. Some do better than others, and I've worked in some places where it's been very open and lots of questions, and my practice now in neurology is great. There are lots of questions. We have 5 different locations, and I've got people reaching out to me from other locations asking me questions because I'm the only one that strictly does concussion throughout the whole 5 locations. But it's cool to have that opportunity to share with my colleagues, with other providers. I've done quick breakfast talks for primary care groups around us, and now doing the whole circuit on lots of bigger conferences as well. But I think it's kind of on us a little bit to share what we're comfortable with so that other people can learn because we've had the opportunity to learn from that personal experience. Whereas not all of our colleagues have had that. Thank gosh for that.
Yeah.
Be a little bit nicer. Thank gosh, whatever for that. But it's an experience that they're not going to understand unless they hear it from potentially somebody that they know and respect and see at a different level than patients. And I hate saying that because I always feel bad for the patients that don't get listened to. But there is that different level of respect and listening when you're listening to somebody who also works in healthcare.
Yeah. Yeah. I think we're still learning that aspect. There's a lot of barriers, but we also have a lot of turnovers. I think it's getting better, but at the same point, I think the stigma is still there, which is
Mm.
why I've been kind of reserved. But I'm also wondering, how many other individuals that I'm working with or that are in my state that are just hiding.
Mhm. Yeah, I think it can go both ways. Like, I've told lots of people that I've had a brain injury, and sometimes they kinda look at me like they're surprised that I'm not back to full-time yet because I seem to be doing just fine. "Well, why aren't you working full-time yet?" "Because I still have limitations that you might not see, and yes, I'm doing all these things, but it's there are still limitations. There are still things that aren't quite back to what they were. Are there some things that are better? Heck yeah, like my knowledge level. That's something you can't ever take away, and when you get kind of pushed to do something like you went back to school, you got your further degree, you got that extra knowledge to back yourself up, more, I guess, just degree power with more alphabet soup behind your name. You did that despite having that head injury.
I still think I'm viewed the same way with the head injury. I mean, and part of that is my clumsiness, which never changed. Occasionally, my husband calls them my Carmen moments. I've run into the door that's not open. Sometimes it's a glass door, and it's like, well, there's a door there.
Yep, that happened.
But at the same point, I'm like, you know what? I did that before the head injury, so I
So
view
probably
that as
not
a
too
positive.
far off.
Whenever that happens, I'm like, that's my normal. That's me being me. And then I'm just like, yeah, we just don't want a lot of those.
Yeah. Yeah, that's all right. That's all right. Um, what other things do you think set you apart as a provider in this space?
Understanding the other side. I think a lot of people think that they understand the other side, or at least they've read about it. Being on that side is a totally different experience. Like, are we allowed to talk about sex?
Mm-hmm.
So like that thing definitely changed. Libido went down, and of course, everyone's focused on the person that sustained the injury. No one talks about the other person.
Yeah.
And I'm like, well, we got two patients here because he's also affected because I'm in
Yeah.
my own little world. And he's like, where's his wife? So we kind of started figuring that part out. There was also, you know, mood swings, things that, I used to probably enjoy that I was like, yeah, I don't want to do that. And it was almost like we were redating again, which was really, he thought it was fun. I was like, well, I don't know what I like. I don't know what this is. I guess we're back to this. Let's experiment. And I'm like, I definitely don't like that. So there is that part. But yeah, when you talk to other providers about the other side, I mean, I bring up, I'm like, well, do you talk about sex a lot with your patients? Because that's just about as uncomfortable it is when you're trying to share information that you're struggling with. to somebody who doesn't get it. And I mean, we all get one part of it, but we might read about it, but do we really experience it? And that's where I've gotten a lot of providers that are like, no, I actually really don't get this.
Yeah.
Then I tell them, I'm like, there's some days where I'm like, I think I get it, but there's always a few that I'm like, no, we got some puzzle pieces we got to fill in, which is awesome because I get to help navigate this with you. And we figure out something that maybe I never experienced in my concussion, which is awesome in a way because every concussion is different. So I'm like, this is unique to that individual.
Yeah. 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 When I have opened up to my patients, there have been sometimes they're like, well, did you experience this too? And there are sometimes I'm like, no, I did not. I was lucky I didn't have that part. I said, but I've read a lot about it because I know it's a very common thing to have happen. Like the tinnitus. I never had that. Thank goodness for
That's
that
the
because
worst.
it is. And just hearing what other people describe it, I'm like, oh, I'm so glad I didn't have that. But yeah, so there are things that I have not experienced, but I can still help you with it because I've talked to plenty of other providers that do understand it and have seen it on a regular basis. And no, they may not have all experienced it, but some of the best providers I know are curious and they want to learn more and they ask questions. So they'll find people like us and they're like, well, hey, can you tell me more about that experience? Because I don't know it from my education level. And I it when people do that. Like that's like my biggest thing that just lights me up when another provider asks me, well, what can you tell me about this? I'm like, heck yeah. Like I have all my visual tools on my desk. And one of my other APP colleagues at work, he's like, well, can you show me what you do with this? I'm like, absolutely, let's do it. So that's when my nerd comes out.
I got one where I didn't even realize that dysautonomia was something that you can get. And I started having these weird symptoms like POTS, the heart rate changes, didn't even realize that I felt like I was going to pass out randomly, would just be like, I got to lay on the floor. This is weird. And then like get these weird like rashes. Well, one of the providers was like, yeah, it's dysautonomia. And I'm like, what? What is that? I'm like, I've dealt with all these symptoms. He's like, so they're managed? I'm like, kind of. I'm just, trial and error here, like sourdough bread. I think I got a starter nose, but we're not the great recipe.
Oh,
So I'm learning like a few things, like wear the compression stockings, don't pass out on your mountain bike, make sure you load up with salt. Yeah, that was a thing. So I was like, yeah, I can't be passing out on a mountain bike here.
No, that would not be good.
But I will say, opening up those weird things that I was experiencing, I got more providers that I think also experienced this because they didn't say it, but they were describing it in a way of, yeah, this is what it feels like. This is what you're doing. And I was like, yeah, you and I need to talk more. This is great because you're giving me pointers and I don't want to be diagnosed with something officially, but I'm like, if it works, great. We'll just stay here. But yeah, and then there's the hypermobile that came about, which I was like, great, we got that going on. But then I was like, well, I can just get handlebars that don't allow me to hyperflex my wrist so I don't get a joint injury. So I'm just trying like adaptive tools. And mainly they're just giving me suggestions where I was like, this is awesome.
Yeah.
But it's not EDS. And we found that out. I was curious. So we did the new scoring that's coming out. So it's just a spectrum disorder, which I relate it to the brain. The brain is on a spectrum. The body's on a spectrum. We're just all on my own little various spectrum. That makes me me.
Yeah. Yeah, that's kind of I do the same thing with that because I'm on the neurodivergent spectrum now too. I've got characteristics of that one going on.
I just tell people I'm missing some chromosomes. The synapses are not aligned here.
I just often end up telling people that my filter broke in the accident and things come out that aren't necessarily always the softest things that can come out of my mouth. So that's fun.
Yeah. Just the very bluntness. I will say, going back to talking, so for the longest time, I did not realize being a female and engaging to males, being curious about something is viewed as flirting. That was a new thing with the injury. My husband was like, yeah, you kept talking to that guy. And I was like, the conversation was really engaging. And he's like, yeah, you kept talking to that guy. I was like, Oh, no. So that part where I was like, I didn't have my cues of, oh, I'm stepping over the line. But luckily my husband's like, don't worry. I got
Good.
some bumpers here out for you. You'll eventually run into them.
Oh my gosh. Oh my gosh. All right. So you kind of shared at the beginning about this book, but would you have any upcoming events or projects that you want to share, such as your book?
Yeah. So my book, Wired Differently, it's about my story. You don't have to read the whole story, but it is literally, me, ass up, everything's there. You get to see it. Not literally, but
Yeah.
figuratively, you're going to see. I would sell a lot of books.
For a totally different reason. Yes.
Right. Yeah. I wonder, that, people sell their feet pictures.
Right? There you go. Or only
I don't
fans.
like
There's
feet.
that too.
Anyway, this is a brain. This is just mainly my experience, what I went through, what I used to get through, and workbooks to help keep organized throughout each doctor's visit. Mainly, it's like maybe you just get there and you are so overwhelmed with all these symptoms, which, yeah, it's a fucking pie in a face and it's not the enjoyable kind, like the cream pie. It's like an overcooked, burnt pie thrown in your face with the fire alarm going in the background.
Oh, jeez.
So that's basically, it's the recipe to get through it.
Nice. That sourdough recipe, right? The starter.
Yeah, it's not the finisher, but it's the starter. You make the finisher. I'm still working on my finisher.
Very true. Yeah. Our stories are not finished by any means.
Yeah.
Where can people find you if they have questions? They want to find out more. Where can they find your book also?
Yeah, the book is on Amazon. It's free for Kindle. I think it's like $18 paper, but half the profits that are made through the book are actually donated to 906 Adventure Team. They're actually the creators of the hardest mountain bike race up in Marquette that I'm signed up to do. But mainly because the guy that built this program is all about resilience and redefining your limits. And I was like, I really liked that because that's what I did. And it's challenging yourself at all levels. So he has kids, he has people that are adaptive that need equipment, but he doesn't tailor anything to those individuals. You test your limits like everybody else. And I'm like, that's life. That's really what it is. And you may not finish, then you'll have unfinished business. But it's about, building yourself up, not competing with anybody else. And that's why I was like, half the profits to the book are donated to that because there's a lot of individuals that need, especially even as kids, need to have that resilience. They need to test them out, before life happens. Because when life happens and you have to learn the resilience as an adult, it's really shitty. But at the same point, you'll learn it. You'll stumble a couple of times. You might end up on the floor naked, but I mean, that's the part. Unfortunately, it won't be with tequila, but it'll just be
No, you won't need it to feel the dizziness.
right. I mean, you might wish you were on tequila. But yeah,
Gosh, isn't that the truth?
it is. It's just, a recipe. It's not going to be perfect. It's going to be something that you can adjust or make it your own. But
Awesome.
as far as contacting me, LinkedIn is probably the easiest. Or I go by, for mountain biking, Headway MTB at gmail.com. And it's not affiliated with the Headway in UK, which is brain injury recovery. This is totally different. This is about navigating your brain injury. You don't have to be a mountain biker to email me, but generally I get a lot of mountain bikers that do email. So I just kept it, with the MTV.
Very cool.
And all of that information is in the book.
Are there any last?
This is the book.
Okay.
Yep.
There you go. Sweet. So for those watching on YouTube, you get to see the picture. And for those not watching on YouTube, you got to go look at it. Yeah.
Yep.
Cool. Any last words of wisdom you want to share as we wrap up?
Life's an adventure. It's all on how you handle it. And there's no survival guide for it. You're going to have to figure it out. But that's the best part.
True. Yeah. Yeah. That's awesome. Good words
you
to
get to
end
meet
on.
wonderful people along the way, like you, Mandy.
Aw, thanks, Carmen. Thanks so much for being here today.
Yeah, thank you for having me.
Thanks for tuning in to this episode of Brain Wellness, the podcast. If you enjoyed this episode, I encourage you to subscribe, like, leave a comment, and share it so that others can benefit. Please also consider supporting the show by buying me a coffee. The link is in the show notes. You can also go to www.brainwellnesssolutions.com to catch the latest info and get links on all of the social medias there. See you next time.